There's a lot of noise about nitric oxide, and that's the problem.
Yeah.
There's so much noise that at the end of the day, it gets so confusing that I looked into nitric oxide at some point. I didn't see much, didn't understand the concept and the reality of it. So you give up. You see it as a supplement.
Yeah.
It is way more than an over-the-counter supplement.
Well, I think it's a huge problem. And, you know, I coming from a scientific academic background, I think it's my objective to kind of maintain the integrity of the field and maintain the integrity of the science. And, you know, after the Nobel Prize was awarded in 1998, there were a number of companies that just flooded the market with nitric oxide products. And, you know, today that continues. And so there's some companies that are just naive, they don't understand the science and the biochemistry, and that's fine. There's other companies out there who know the science, but are deliberately deceptive and fraudulent in their marketing. And I think, you know, you make a very good point, because people, either physicians or patients, try these nitric oxide, so-called nitric oxide products, and they don't get an effect. They don't get an improvement in blood pressure and normal kind of physiological function. So they say, oh yeah, I tried nitric oxide and it didn't work for me. And that can kill the entire field. And it's too important, this field is too important to do that.